I'm Dr. Rick Greene from the UVA class of 1970 from the medical school, and it is my great pleasure to host this program to honor our emeritus professors and wonderful faculty who taught for many years at UVA and now are doing some interesting things outside of medicine or within medicine. And today it's a pleasure to have really a contemporary, Dr. George Craddock, with us. And George, thank you for being with us today.
Oh, I'm honored. And you're much younger than I, the class of 70. I was a class of 68.
Those 2 years make a lot of difference, yes.
Well, we shared a lot. It was a very interesting time, as we talked about. You know, everybody had some type of uniform service. We had very few women. We had 3 in my class, which was a definite exciting improvement. But the classes were small and very intimate, and we really knew who was in the School of Medicine. I think it's so much larger now, they miss to a degree the closeness that we all had.
Right, we had small classes, and now I think we're up to about 160 students in a class.
Yes, it is. It looks huge, and obviously they're brighter than I was, and the mix is wonderful, and I feel very positive and encouraged for the future of our school.
Well, you went to W&L, and you came here to UVA for medical school, and obviously left for some training up at Philadelphia. But something brought you back. Tell us, first of all, why did you migrate into cardiology? What was the force there?
Well, cardiology is really, I think I hit it really in a wonderful period where it changed dramatically. It's become very technical now. I think there are about 3 reasons. First, my class in 68 was the first class that had a senior elective program, and you could choose what you wanted. That was a radical departure. And my good friend Dick Garant, who you all know is on the faculty, we spent a month with Julian Ruffin Beckwith, who was a very large personality and a wonderful clinical cardiologist and a distinguished electrocardiographer. And really in that month, we learned to read electrocardiograms, and that excited me. And secondly, the heart obviously is the center of the body, but the circulation really was not well understood until relatively recently, when catheter invasion and hemodynamic measurements of the circulation became apparent. And I was sort of in that at both Philadelphia, and I was very fortunate to be a clinical associate at NIH. That was my uniform service. I was in the public health corps. At that time they had 200 what they call clinical associates there, and we were sort of like residents without weekend call. It really was wonderful. And I got really fascinated with catheter work, being able to measure hemodynamics. And I think it really was through my exposure here with the wonderful, very small division of cardiovascular medicine, and then having those experiences in my training program.
Well, obviously you had a choice. You could have gone into clinical cardiology as a practitioner in the community. You could have gone into academics. Your time at NIH, obviously involved in research and some of the things, brought you back to an academic life. Was that a factor?
A factor, and of course I'm a native Virginian, and as you remember, the School of Medicine then, half the class was from Virginia, interesting, and the other half the class was from all over the United States. But out of the half class who were Virginians, I'd either been to boarding school, university, or camp with those, and just the wonderful fellowship that I felt made the University of Virginia School of Medicine special to me, and I, of course, feel blessed to have been able to come back and stay here. And with the division really under the directorship of George Beller, who 2 years preceding my graduation and 4 after yours, really built a rather small clinical department into a nationally known department, and I just felt privileged to be a part of that. And largely I was a clinician, and in the invasive laboratory when there were only 2 faculty members in there doing those procedures, and I felt blessed to be here.
Well, obviously being here, as you were also a teacher, you were also a mentor. Well, tell us a little about your feeling about that, and the importance of that as it affects your career as a cardiologist in an academic environment?
Well, one reason I went into cardiovascular medicine was the mentors that I had. We had wonderful clinical teachers, I think, through that period, and the faculty took a real interest in the students, cared about their welfare and where they trained, and mentored and advised us. And that was always sort of a paragon of a physician to me. And the ability to do that, I was as interested in the history of medicine, in the clinical examination, and the students that we had. I think students became better. I learned from them, and I felt blessed to be here. Of course, I live in Ivy, Virginia, in Albemarle County. There's no better place to live, and to have the ability to work here in a major medical center and live here where I feel my gene pool is from. I've just been very, very blessed. But I think we were talking briefly, I think you look back on the mentors that we had. The faculty was small, but they had a real commitment to the School of Medicine. They stayed and they cared about us and really helped shape us in our futures.
Tell me a little about what you've been doing recently. You've as you've stepped down a little and back from clinical work, what are the interests that you have now in life?
Well, you'd be interested. I had a mentor at Penn who was there for a long time, and when I decided I was going to retire at age 71, I called him up and I said, "John, you retired about 4 years ago. You had a lovely mainstream practice. How did you, tell me what you think about retirement?" And he said, "George, retirement as a clinician is simple. You go in the Federal Witness Protection Program, you change your email on your phone, and then you try to figure out who you are and what you want to do." And for me, I'm a walker, and there's no better place to walk. Since I've retired, I've lost weight, I feel better, I feel stronger. I love Bath County, Virginia, which we know well. My family's had property there, and I have another place there, and I go there as much as I possibly can. I admit, when I thought that I was going to retire from my practice, I spent a lot of time trying to farm my long-term patients out where they would be happy, but they don't call me, and I spend little time following the division here. And I think it's a lot of peace for me in that I did it, and I'm a reader, I'm an amateur historian, I have a lot of activities in that regard. Lastly, I thought, well, I'd never have grandchildren, and I've got two. One at 5 and one at 1.5 years. And my mother lived only about an hour from here. She lived 102, and after retirement I've had the real privilege of spending time with her until she died, and with my family here. So I've been extremely fortunate.
Well, Charlottesville has had a major part in your life too. I mean, just being in the environment here. What is it about this community of scholarly activity, or this area, that's really sort of kept you excited over the years?
Well, it's a unique area, and when we would interview for faculty members, I felt like I was the Chamber of Commerce. I would say how fortunate all of us are to live here. And I think Charlottesville, Albemarle County has grown dramatically since we were here, about threefold. But it is a university intellectual community, and I tell people, whatever their interests are, you can find people that have a similar interest. And despite the tensions in August, it has been a very agreeable place. It's become really a retirement community from the Northeast, which surprises me, the growth. And people come here, I think, because largely you're left alone. Even if you're an actor or a glitterati, people leave you alone. They're cordial, they respect your space. And obviously we have the University of Virginia here with all the activities going on. So I've really been blessed to have worked here and to retire here.
Have you kept involved in any activities at the medical center or the department?
Largely not. I thought I did that. One of my colleagues spends a lot of time in the free clinic, which is a wonderful opportunity here. I felt like I ran free clinics for years. I didn't need to do that again. I've kept my license, and I do CME, and I do come frequently to the grand rounds here, which excites me. But as far as teaching or clinical responsibilities, I pass that along.
So if I'm a young resident and I come to you and say, I'm really looking at a specialty, I'm training in internal medicine, what is it about cardiology today that would excite me? Would you encourage a young person, and what's changed about the specialty?
Oh, what has changed is so many things that we have to offer people, which we didn't. More and more cardiologists are needed. You can work almost anywhere in the country. If you like doing procedures and work with your hands, that opportunity is there. If you like patient care, to me it's a lovely thing. Heart disease changes people, but it usually doesn't change much of their personality, which interests me. It's not like kidney failure and pulmonary failure. Largely the people's their personality remains intact, and that was a joy for me, for following people for so many years, and really have something to offer people.
Well, let me say that on behalf of the Medical Alumni Association, we value all of the work that you've done at the Medical Center and the many students you've taught over the years, and it's such a pleasure to be with you today. I want to thank you.
Rick, thank you.
My pleasure.
My pleasure.